When you look at the entire database, males are at higher risk of all types of injury, homicide included. So if we're going to look at all workers, the males are still at higher risk. But the startling thing is that such a large proportion of the females killed in the workplace are indeed killed as a result of a violent crime.
One of the biggest causes of assault is understaffing.
Myself, I have been hurt several times, a couple times quite serious. I've had a nose broke, I've had a jaw broke, I've had a back injury that I'll have to live with the rest of my life.
Shirley Starcher, a member of Service Employees Local 1199, is a registered nurse at Weston State Hospital, which today cares for 250 mentally ill clients in the Central Hills of West Virginia.
When I first came back as a nurse, it was nothing unusual for a nurse to have 7 and 8 wards per shift. And you're talking at that time there were 40 and 50 clients on each ward. You couldn't do hardly anything, let alone the maximum.
Conditions worsened. Patients were sleeping in hallways. The client-to-staff ratio soared to 11 to 1. The number of assaults skyrocketed, but remained a private horror until workers forced the issue out of the closet.
The straw that broke the camel's back was a healthcare provider being assigned to a designated smoke area for those clients who wanted to smoke a cigarette. There were 20-some clients in the room, one staff member. There was an altercation broke out between 2 clients as to who was to get a light first. The staff member was pushed down and injured to the extent that I believe there was 10 work days lost on workman's compensation.
What they were going to do would be...
Ron Grogg, chair of the Health and Safety Committee, filed a grievance on behalf of the injured workers.
The main action was not the filing of the grievance, but it was the insight to make it a mass grievance to where they knew that they had 33 people who were concerned and were having problems coming to work at it rather than just one individual challenging the boss. That way it really gave the grievance some substance.
It took more than a year before the case was finally heard by state officials supervising Weston Hospital.
A week before the level 3 grievance, we suddenly had everything that we wanted to achieve with the grievance. The administration come around and changed an 11 to 1 staff ratio to a 5.6 to 1.
Since the ruling, assault rates are down. Staffing levels have held and conditions have improved. Still, workers are vigilant. They know patients have rights, but they have rights of their own.
There's not a person at that hospital that doesn't believe that their primary function there is to care for the client. And with the type of workplace it is and the type of violence that does exist, you would not get up and go back to work the next day if you didn't have within you a very sincere commitment to the mentally ill.